Hey everybody, it's John DeYoung and congratulations. If you're watching this video, you finally did it. You had your hip replacement. Bravo. Obviously the hard work is post-surgery, but kind of shocking how fast you can get up and get moving and be pain-free. I've had some clients go, they spent one night in a hospital. Some people actually went home and kind of shocking. The recovery is great. I'm sure you already know that you're pain-free. At least you have that feeling of pain-freeness, and moving forward is only going to get better for you. So I want to go through weeks 1 through 4, kind of refresh some of the easier movements, some of the early movements you do in physical therapy, and then from like 4 weeks on, things you're going to do for the next month or two, obviously with clearance from your PT or your doctor. But it's really good to really just refresh yourself with the early exercises they had you do, because that's a great way to warm up to do the more challenging ones. Again, talk to your doctor or your physical therapist, get some clearance on these. You may have some limitations on range of motion or certain exercises you're not ready for, because I obviously don't know which week you are in recovery. So first few movements we're going to do, again, kind of ones you've probably done already, and then the last few you may not have. So all right, good luck to you, and let's get going. Okay, so we're going to start with probably one of the first things you tried, probably the first week, but going into the second week. We're going to do a little heel raises. So you're going to come up on your toes, and you're going to hold and lower yourself slowly, okay? Again, a good way to warm up, even though you've done these already. So heel ups, a little hold, lower yourself down slowly, okay? Now, going into that, probably again, 3 sets of 10. But now you can add a little variation. We're going to come up, squeeze your glutes for 1, 2, 3, and relax. And then we'll add a third variation with your rolling back on your heels, bringing your toes up. So we're going to go heels up, squeeze your glutes, roll down slowly, and toes up, roll up, squeeze your glutes, holding, relax, roll down, let it fall. Toes up, now we're heels up. Okay, again, probably about 3 sets of 10. Squeeze your glutes, holding up there, roll back down, and toes up. Okay, so you're going to combine all three, kind of, just the heel raise is kind of like week 1, week 2. So is rocking back, getting your toes up, adding a little squeeze in the glutes. Again, kind of preliminary, kind of early movements you did post-op, but great way to warm up for doing more difficult stuff. Okay, now we're going to get into, we're going to raise your hip. This is a hip hike, but the hip that's raising is not the surgery leg. So say my surgery leg is my right leg. I want to bring my hip up. You can hold something also. Hip up. I'm going to hit my gluteus medius. Little pelvic stabilizers, just trying to hike up and hike down. Keep both feet, toes straight ahead. It's called a hip hike. You're going to feel that. I wouldn't mind doing, let's switch. Let's do both sides, because you're going to feel the gluteus medius. And it'd be nice to do both sides as well, not just your surgery leg, okay? And that should be fine. It's pretty, again, the opposite side's doing the work. So I know your doctor's having you do the surgery side, but it's actually relaxed. You're actually working the opposite side. So you should do both sides, okay? The hip hike. Whew. And again, try to stay nice and even, toes straight ahead. Whew. You're going to feel those. Those are fantastic. Okay, let's move on. Okay, for the next exercise, you've probably done these already. These are the heel slides. Again, great for flexibility and mobility. We're going to lay flat. This is your operated leg, which is going to be, we actually start with that straight. You're going to point your toes. The other leg can stay put. Try to relax everything. Point your toes. You're going to bend at the hip and at the knee. Slide the bottom of your foot in. Again, check with your doctor and your PT. They may want limited range of motion, depending upon how far you are in recovery. Okay, you want to bring it closest to the butt as you can with the heel down. And point your toe. Going to do about 3 sets of 10 reps. Okay. And if you feel pain or discomfort, you're going to stop. Go to where, right now where it's not uncomfortable, but you feel that tightness, okay? Obviously, again, depending upon your communication with your physical therapist and how far you are in recovery. So these are called heel slides, okay? And slide that in, just like that. Okay, the next one is called the quad arc exercise. We're gonna stay on the table. We're gonna put this foam roller right under your knees, okay? Again, we're gonna say this is my surgery leg. It's a great one to have in your war chest because moving forward, you can actually increase by putting weighted ankle weights on your ankles. Okay, so you're gonna relax your leg, toes up, and you're gonna raise your toes to the ceiling, toes up. You're gonna contract your quadriceps, hold it for 1, 2, 3, and then down. Let it rest, toes up, and squeeze, okay? Again, about 3 sets of 10, and hold. Toes should be pointing to the ceiling. You can feel that quad contraction, may feel a little hip flexor. You could use a towel instead of a roller. Good, and squeeze. And again, 3 count, 1, 2, 3, and down. And squeeze. All right, 3 sets of 10. Now the great thing which you can do moving forward, once you get clearance from your physical therapist or your doctor, is add some weight. You're going to add an ankle weight to that. Everything else being the same. Toes up, bring it up and squeeze. Again, make sure you get clearance for adding resistance, okay? And then bring that up. It's nice to fire the quadricep muscles. You're going to get a little hip flexor in here as well. Hold for a 3 count right through here. And you're going to feel a little in your hip and squeeze. Very nice. Okay? Beautiful. All right, let's move on. Okay, we're going to stay in the table again. This one is called the prone knee bends. Okay, so we'll just say my right knee or my right leg would be my surgical leg. Okay, the one that was operated on. You're going to make sure you keep contact with the table with your foot. You're going to bring it up until your toe is pointed to the ceiling, making sure your quadricep is keeping contact with the table or the mat, whatever you're laying on. So this is really the only thing you have for hamstrings. It's really important to hit that, point that toe up, and watch that range of motion in your hip. Toe should be pointing right to the ceiling. And keep your quad down. This is called prone knee bends. It's really the only thing you have for hamstrings, unless you do the standing knee bends, which I'll show you later. Good. And bring that up. You're going to lay in your stomach, point that toe. Now what you can do, again, if you get clearance from your physical therapist and your doctor, would be to add weight on this. Ankle weights are great. And again, everything being the same, my right leg would be the leg I operated on. Had operated, point your toes. Okay, toes to the ceiling. Don't let your quads come up. Keep your leg firmly on the table. Again, 10 reps, 3 sets. Good for hamstrings. And right through there. Okay. Okay, dokes. Let's move on. Okay, and lastly, we're going to do a few variations of the bridge, which I'm sure you've been doing already. The first variation would be palms down. We're going to come up into a bridge, nice straight line, squeezing your glutes, getting a little pelvic stabilization, probably 5-second hold, and then down. Way to make it more difficult if you've done these. Less balance with your upper body. Again, bridge, 5, 4, 3, 2, 1. Really squeezing your glutes and then crossing your arms across your chest. Less stability. The upper body's not helping with stability, so it's more unstable. So you really have to contract your glutes, stay balanced. And a 5 count, okay? Arms up and squeeze. Again, 3 sets of 10, 5-second hold at the top, squeezing your glutes. And then as you get stronger, moving forward, we'll go in the most difficult position first. Arms up. Ooh. We're gonna do a march and hold for 1, 2, 3. It's really difficult with your arms up and holding 1, 2, 3. That's nice. If you need to bring them down, a little stability, keep your elbows down. 1, 2, 3. I actually do these now for my psoas, little pelvic stabilization. I have a little SI or SI joint pain sometimes. So hip stabilization is so important, especially for you guys coming post-surgery. Okay. Whew. Those are great. Okay. So, okay, great. Good work. Really good with your rehab. Keep it going. Again, get clearance from your doctor and your physical therapist on, especially the marching. That's a lot of stability, okay? So make sure you're ready for that. And again, I have hip issues, so a lot of these exercises I do is warm-ups for my hips before I get into like leg exercises, squats or Bulgarian split squats, lunges, before going for a walk or a run, whatever it is you do, okay? So it doesn't hurt to keep your hip, glutes, and pelvic stability and alignment in check, alrighty? Great job, guys. In the description is going to be little links for some of these ankle weights, a foam roller, things that you can use. And that's it. Hit subscribe if you haven't, and good luck with your healing. And shoot me any questions if you have something you want to ask me. All right, thanks a lot, guys.